Welcome to For Mannerless Women. I'm your host, Adelle Onyango, and this is a space that is committed to nurturing a new generation of shame-free women who are ready to meet their best selves. And in this episode, we are unpacking the vagina with Dr. Sule, who is a general and cosmetic gynecologist. I am so excited to finally have you on the show. I think you've been on the top of my mind since we began For Mannerless Women, because in the conversations about women owning their bodies, we have to talk about the body parts that are taboo to be spoken about. And I love how you tackle misinformation, disinformation on your social media. I love everything you're doing with Alora. So I'm giving you your flowers before we begin. And thank you for making time to be on the show with us.
Thank you for having me.
Yes. So I want this episode to really be a deep dive into vaginas. And I'm so excited because I just feel like in my 30s is when I started being like, hang on, there's no shame around this. Right. There's no shame even around the words, And so a good place to start is, what are some things that fascinate you or, you're always like, wow, when you think about vaginas in just their being? Is it something they're able to do that people don't talk about? Is it the nerves? And what's something that's fascinating around vaginas?
I mean, everything. Really everything, which is, the reason why I became a gynecologist to begin with. But really, it is truly fascinating. I think, firstly, most of the women, or actually most people, confuse vagina and vulva and use that interchangeably. So even just to understand what vulva is and what vagina is.
Good place to start.
Because everybody calls it vagina, even when they're referring to the vulva. So, which is basically, the vulva is the external genitalia, the labia majora, the labia minora, the entrance of the vagina. And then now there's the actual vagina itself, which is muscular tube. But I think, yes, one of the things that you've alluded to that's really interesting is the number of nerves, millions of nerves in the clitoris, truly probably no other body part with that many nerves, so that's really fascinating. The fact that it's a self-cleansing organ, which I love to tell women about. This is not like your mouth where you have to brush your teeth and your tongue because you ate food and now the gunk has to come out. This is nothing like that. Literally self-cleansing organ. So I think that's really fascinating. And of course alludes to how women take care of their, their feminine hygiene.
Yes.
The other thing that really interests me, just fun fact, is the ragi.
Okay.
So the vagina is actually ribbed. It's a ribbed organ. So it has furrows, right, all along. And then as you get older and towards menopause, those furrows decrease. They get less and less and they thin out, and the blood supply to the vagina decreases, and the nerve endings kind of lose sensitivity, and the glands stop producing as much lubrication. So I always say that if someone showed me a picture of the vagina, I would always know whether this is a young woman or an old woman, just by how it looks, because of how it changes. It becomes, thinner, less pink, less rugged, almost flat. And actually, that's one of the ways in which, cosmetic gynecology comes into the picture, because we're trying to reverse all of that.
Yes.
So I think that's a really fun
That is interesting. So you could look and tell someone's age.
I could definitely look and tell that this is, someone in menopause or someone not in menopause, for sure.
Yeah. I love how you light up, and it means that you are doing the work that you truly are passionate about.
I do love what I do.
And that's why you do it so well. Yeah. And so maybe we can tap into, now that we understand what the external, and sometimes we use, wrongly, we interchange vulva, vagina. One thing that I always used to find fascinating with my late mom, we used to do a lot of breast cancer awareness. And even things around your breast, because there's so much shame, women would come when the lump has progressed into something else, and they didn't even catch the lump or any dimpling or any change, because they actually don't know how their breasts look like. They don't touch them. There's a shame around it. And that's breasts. Vaginas have, I think, another layer of shame as well. So we don't know what's normal. And because we don't know what's normal, we don't know when maybe something, we could have caught something earlier, right?
Yeah.
So what's normal, what's not?
Yeah, that's a really interesting question. And I totally agree with you. And I always like to refer back to the breast as well. You know, when you know what's normal, then you know what's not normal.
Exactly.
I have a lecturer, actually Professor Ann Kihara, she's the president of FIGO. And when she was my lecturer, she used to say that the reason women get vulval cancer is because they never use a mirror. She always used to say that. And the reason is because you never look at what it was when you were younger, what it is when you're older, what it's becoming, what's off, you know, and it's perfectly fine to say, I think this is off, and then, you know, see your doctor and they go like, no, that's actually normal. That's perfectly fine. But truly, if you never look and you never use a mirror, you will never know. So in terms of what's normal and what's abnormal, especially in the outer appearance, we basically have, you know, the vulva, and then we have the vagina. Sometimes women can tell even when there's something off inside, you know, when you felt it or your partner felt it or something was off, you know. But there's a lot of variation in actually what's normal. And maybe that's the thing that confuses women, you know. We have variation in size, we have variation in color, we have variation, you know, in texture. And by size, I mean both, you know, labia majora and labia minora. Some women will have like a slit-like labia minora. Some women will have like a flower petal kind of labia minora, and they'll think, you know, because mine is like this, then the slit-like is abnormal or the other one is abnormal. There's variation in color. For a lot of women after breastfeeding, they get a lot of hyperpigmentation. So then it gets darker. Or even through certain medications or through certain hygiene practices, it gets darker, and then they think that that's actually okay, but maybe the medication you're taking is causing this, and maybe you need to go off that medication. So there's a lot of variety. I usually like to tell women that there isn't quite normal and abnormal, so to speak, if everything is okay. Of course, if you have like a blister, you know, if you have a wound, if you have something itching, if you have a rash, if you have something that's pus is coming out, that's obviously abnormal. If there's pain, of course, all of that is abnormal. But on a regular day, when nothing is going on, what's normal and abnormal is actually defined by you.
And that's why you need to know
exactly
what was the baseline of normal to begin with.
Exactly. It's defined by you. What feels comfortable, what is now uncomfortable. You're the one to actually walk to a doctor's office and say, you know what, before I used to have better lubrication, now it feels kind of dry. Because nobody will know that for you. Truly, it's only you, you know. So I usually say normal and abnormal is basically the comfort level that you have and the aesthetic. Things could be perfectly okay and nothing happened, but you just don't like the way it looks anymore. Maybe after having a baby, it changed, and that's perfectly normal to say, you know what, I don't like the way it looks right now. So for me, I really go by what my patients are saying, unless, of course, there's an obvious pathology. You know, for example, if you have herpes, it's going to be there. I can see it. You can see it. It's truly abnormal and we have to treat it. But on a regular day when everything is normal, I ask you, how do you feel? You know, if, for example, there's an abnormality in your sexual function. So, for example, some women will have babies or they go into menopause and their labia minora will get really long to the point that they're unable to have sex comfortably or unable to do their daily activities normally. They can't walk, they can't run, they get chafing, they get rubbing against the labias. That's not normal now because now you cannot do your regular activities again. So the scope of normal is so very wide that truly I say it's for you to say, today this does not feel okay or today this doesn't look okay. You've heard of the wall of vulvas?
Oh yes, like in the museum.
Exactly. So there's so many types. So
I think I heard of it from your page.
Yes. One of my followers actually posted it out, and I've never actually physically seen it, but I've seen many pictures. And when you see the number of variations, it can be confusing. There's like over 40 variations, and then you say, okay, where do I fit in? What's normal? And sometimes you probably won't even fit in. So what's normal for me again is defined by you.
And you know what is so sad is that I think maybe we have been trained to think that our vulva needs to look one
particular way.
You know, and if it doesn't, then you don't even speak up because you're like, something is wrong.
Absolutely.
And I'll just keep it to myself. But that wall, I saw it on your page, and it's like there are 40 different.
There's so many different types.
Wow.
Some countries have more than others, and I think partly one of the reasons where the confusion comes in is also because when we're raised, nobody really tells us about what anatomy looks like. You know, like what is it supposed to look like? You just kind of grow up and then you look down there one day and you're like,
yes,
okay, you know, this is how this one looks like, you know. And also, nobody gives you the right nomenclature. Nobody tells you, you know, this is the clitoris, this is the labia minor. Nobody tells you any of that.
Because of the shame.
Because
it's like,
of the
let's
shame.
not talk about
yeah,
it.
and the shame is cultural, it's religious. Sometimes it's just upbringing, you know.
Yeah.
It's something to be hidden, not talked about. It's shameful. You shouldn't talk about it before you're married. You shouldn't talk about it after you're married. You shouldn't talk about it when you're old. You shouldn't talk about it when you're a child. Like, it's at what point do you actually, you know, get permission to talk about it?
And in what spaces, it's almost like if we talk about vaginas, what we're talking about is sex. And I'm like, this is
Sometimes
not synonymous. It's not synonymous,
For
guys.
sure. Yeah.
This is so intriguing to me. And before we move into, because, you know, I really want to understand more about cosmetic gynecology, which is, you're one of two in Kenya doing this. With the mirror, so that the woman watching can probably try this today. How should I do? What should I do with the mirror?
So, I mean, really, it's a very personal thing. Women, you know, sometimes you want to go after a shower when you're very comfortable. Some practitioners say put the mirror on the floor and then stand with your legs apart and just have a look at the mirror and see, you know, what's going on. Some people prefer to do it when they're lying down. Some people prefer to, it's just kind of like tampon insertion, you know. There's different ways to do it. Some people prefer to put a leg on a bed or a toilet seat or whatever and just have a look and see and just, you know, kind of take mental notes of what it looks like today, what it looked like before, what seems to have changed. You know, is there, once again, just like the breast, is there any rash? Is there any redness? Is there any discharge that's off? Is there anything growing that you don't like? Is there any pigmentation that's off? Is there any dimpling? Is there, and you know, truly it's a variety of things. And because I don't expect my clients to be a doctor, anything that seems off, you can literally just come and say, this is off to me. I'll be like, oh, that's actually perfectly normal. I get patients a lot who come with probably pieces of their hymen that have remained and they just don't disappear over time. And they're like, oh my God, there's something hanging out of my vagina. I'm like, no, that's just your hymen. It just never disappeared with time, you know? So truly, it's just about making a pattern of what was normal, you know, is normal, and what now just seems off. Getting reassurance from your OBGYN is perfectly normal. It's perfectly normal. It's perfectly okay to be told, actually, there's nothing.
And I think it's you're exercising that muscle of agency over your body and knowing, right? And then when you come and see Dr. Sule and she says, no, this is normal because you've added more information to what you knew or what you didn't know before. Okay, so now let's get to this thing that I'm completely green on, right? Which is cosmetic gynecology. Right. What is that? Because you are a cosmetic gynecologist. Yes. So what is this thing?
So a cosmetic gynecologist is basically a gynecologist who deals with female sexual dysfunction and aesthetic appearance of the vulva and the vagina. So basically what we, in simple terms, need to do is to make sure that your intimate wellness is okay, your sex life is fine, you're comfortable, you're pain-free, and then also optimizing that, you know, being able to, for example, make nerve endings more sensitive, being able to help you lubricate better, being able to give you tightness. So everything that concerns sexual and reproductive function, but also aesthetics. We do, you know, things like labiaplasties, vaginoplasties, clitoroplasties. We want to make your vulva look closest to what is acceptable to you. You know, we do FGM reconstruction, you know, for people who've been mutilated. We do want to restore function, but we also want to restore aesthetic, you know, and you don't actually have to have undergone mutilation. You can actually wake up in the morning and say, I don't like the way this looks, I need change. Either change because of aging or change because of childbearing, because of those are the two major things that do change the appearance of our vulva, either aging or childbearing, you know. So basically our work is to restore sexual function and also to improve aesthetic appearance. So to be a cosmetic gynecologist, well, you have to be a doctor, right? And the reason I like to emphasize this is because a lot of people are getting a lot of what we call cosmetic gynecology services in spas, in places that you'll get it, like say from a beautician. I have nothing against beauticians, but you're not a cosmetic gynecologist.
Yes, you're
and
not
I think
a doctor.
it's important to be clear with your clients, So first you have to be a doctor, then you have to be a gynecologist, then you have to be a cosmetic gynecologist. So if you're not a doctor, you can never be a cosmetic gynecologist. If you're not a gynecologist, you can never be a cosmetic gynecologist. So cosmetic gynecologists are OBGYNs who've subspecialized in cosmetic gynecology. Now, the thing about cosmetic gynecology, there's no one main course around the world. It's different procedures that we split into different courses, and then we travel all over the world learning from the best experts. So there's an expert in vaginal surgery, for example, vaginoplasty somewhere, and then you go and you learn under him, and then they give you certification, and then you become an expert in that field. There's experts in PRP, platelet-rich plasma treatment. There's experts in FGM reconstruction. There's experts in labiaplasty. And so it's very many courses that we split down, we break them down, we go and meet the highest expert level, and they train us like by hand. They hold your hand and they tell you this is how you do it. And many people feel like, oh, this is really easy. I mean, women give birth all the time, they get tears, and I can just whip it all up and I can just repair it and it's going to be fine. Like, no, these are 3-4 hour procedures. These are precision. We use sutures that sometimes we can barely see with our own eyes. We need like a loop because they're so fine. It's such delicate, precise work. It's like you have to have a very symmetric eye. You have to love symmetry. Like for me, I can look at a vulva and tell by millimeters what's off in terms of symmetry. Like I don't need a ruler, I don't need anything, because it's something that you do over and over and over again.
And training,
exactly. And your eye becomes very trained in symmetry, very trained. Your hands you get muscle memory of fine work. So it's not just something simple, it's something that people train very long to do. And the reason why I like to emphasize the process is because it's important for you, if you choose to get into cosmetic gynecology as a patient, to know who your provider is. You need to be able to get into, for example, the KMPDC register and see, okay, this is actually a doctor. Let's just start there. And then you can see, okay, this is actually a gynecologist. Okay, this is someone who's trained. So they'll give you all their certificates and all the work that they've done. So for me, mine is like from Dubai and Poland. So happy to give those. They'll show you the before and afters of the work that they've done. Like it's a really important process, just like plastic surgery. You can't just, like jump into it. You can't be a cosmetic gynecologist and be something else. You can be a gynecologist, meaning, so I deliver patients. I take care of their pregnancies, I take care of their babies, I take care of fibroids, of gynecological cancer and all that. But at the same time, my specialty is cosmetic gynecology. So you cannot, for example, be a cosmetic gynecologist and also be a pediatrician. You can only be a gynecologist and a cosmetic gynecologist. So you still do your basic OBGYN stuff, and then that's your subspecialization. So for example, if you're a fertility specialist, there's the basic OBGYN, and then now you specialize in fertility. And so that's basically what cosmetic gynecologists do and what it actually is.
This, first and foremost, congratulations, because this is a lot of work.
It is.
Like, and a lot of time put into training.
It is.
There's only 2 of you in Kenya.
Yes, there's some under training, but mostly it's because it's not a specified registered field in Kenya. So the 2 of us do really try to push forward and to see how we can get it registered so that it's a subspecialization that's recognized by the board. But right now we do practice it because the demand is there. We are trained in it. It's available and very well established in other countries. So that's how we do it right now in Kenya. Of course, we're wanting to train more and more. Yeah.
And can I just say thank you for, I think you gave me, which I think is always a gift, when you give someone the gift of unlearning something. So the first time we ever met, we did an Instagram live about harmful practices, which we're going to get to. But even in terms of talking about cosmetic gynecology, I think I had a very shame-informed view of like, why would you want to change anything? What are you doing? And like all of these things.
Yeah.
And I really had to unlearn and say, not only is it necessary in moments of maybe a trauma-informed moment, if it's an FGM situation or something that went on during pregnancy, but a woman should have the agency to say, this is the aesthetic I want.
Exactly.
You know what I mean? And have a space that is safe and informed for her to get it. And I really had to be like, why do I think like this? Like, why am I think it's that shame you carry on of like, don't touch the vagina. What are you doing? You know what I mean? And I just actually want to thank you, because that unlearning helped me be like, oh yeah, that speaks to agency, right? But we talked on harmful practices, right? It kind of follows us whenever we're having this conversation. And I've heard of 2 that were just strange. I think once I knew how powerful my vagina was, I'm like, please, I'm not gonna put anything in or around that is strange, because like, this thing is powerful. Why am I interfering with like how wonderful it's moving?
For sure.
The first one was, I remember seeing a visual of a woman standing over a burner, and it's like, oh, we're steaming it so that the vagina smells good. Yeah. And I was just like, what is going on? That was the first one I saw. The second one was, one of my female friends said, oh yeah, you know, I've been thinking of going for a Vajacial. And I remember being like, what is that? And she's like, oh, it's like a facial, but for your vagina. And I was like, but so why? Like, I don't understand.
Pertinent question.
When I was thinking about when I go for a facial, it's pretty rigorous, right?
And there's a reason.
And And even then, I was just like, wait, but why? What is happening? And for who? Who wants this vagina to look a certain way that you're falling over backwards to please? Yeah. And so what are some of the harmful practices that we're doing outside of Vajacials and like the steaming? I don't know what it's called. Steaming?
It's called steaming.
It's called steaming. Yeah.
Well, before I even get into the practices, I think the why. The why is really important, right? There has to be a reason why if you're a logical person, there has to be a reason why you're doing something, right? And so a lot of women suffer from real problems, honestly. I'm not going to discount the reason that takes them to those practices, because women experience things like laxity, right? So after childbearing or even with age, you get that there's looseness in the vagina. You know, it doesn't feel the same. And it's real. And many women don't know how to express it. They don't even know how to bring it up with their doctor.
Shame.
There's not just shame in admitting it, but also shame in seeking help for it, because you're like, oh my goodness, how am I going to walk into a doctor's office and tell them, I think I have looseness? Like, they'll be like, what? Do you not have bigger problems? You know? So even just the fact that, you know, that kind of issue, but also even being able to tell your OBGYN after delivering that, you know what, before the baby, like maybe you are my OBGYN and now things are just different. Because it may not necessarily be something that your partner may be willing to talk about, because they know that if it is existing, it's happened because of his children, you know, because of the babies that you gave birth to, and they wouldn't want to shame you, they wouldn't want to make you feel bad about it, and you know, they care about your feelings. If you know it's a good partner, they care about your feelings, so it's not something that you would easily bring up with them. So there's laxity. Some women experience really bad dryness, either because of breastfeeding or because of menopause. Some women experience, as I mentioned, you know, lengthening of the labia minora or even the labia majora. Some women in menopause experience a decrease in the fat content of the labia majora. So maybe initially they were like, you know, more youthful, and then now they're flatter, and now they're, you know, saggy, and they're like, okay, is this a thing? I don't like the way it looks. Especially if you're like a fairly, you know, sexually active person, but even just for yourself, you know, just like, this looks so different. Why does this look the way it looks?
It didn't look like this before.
It didn't look like this before. And so especially with the feminine hygiene in terms of the freshness, my goodness, it like literally kills me every time, because in the variations of our anatomy, we also have variations in scent. Not every woman smells the same, and there's no particular smell. There's no lavender or rosy or daisy thing. It's not supposed to smell like that. Like it's actually an internal organ, so it's not gonna smell, you know, great. It has a scent, which is not necessarily a bad scent, because when it's a bad scent, that's the time you need to see your gynecologist, because your discharge is off. But there is a scent to it. And let's all be honest, there is a scent to it, because sometimes I get patients coming like, oh, the scent is so off. It's so off. And I'm just like, actually, it's normal.
That's what it is.
Actually, this is what it is, especially younger patients who haven't had time to explore themselves, you know, enough. So basically what women are seeking in terms of, you know, harmful practices is tightness, freshness, lubrication. But sometimes some of these harmful practices also promise to treat gynecological conditions. And that's where, for me, I'm just like, oh my goodness, this is ridiculous. Your period pain will disappear. Your fibroids will
With that
disappear.
cream.
Exactly. Your hyperpigmentation will disappear. Your cysts, ovarian cysts will disappear.
And that's so risky.
Your periods will become regular with this, whatever it is. And I'm like, that is insane.
Yeah.
None of that is going to happen if you don't seek medical care, because those are serious gynecological symptoms that need serious gynecological attention.
Yeah.
So you're not going to get tightness by whatever it is that you're inserting.
Yeah.
And so for me, some of the harmful practices that we're looking at is Yoni.
Yes, we spoke about that in our live.
Yoni et al.
Yeah.
Yoni and cousins. Yoni and everything that it comes with. I don't know what to call it. And associates, exactly. Yoni oils, Yoni sweets, Yoni pessaries, Yoni inserts, Yoni, I don't know, creams, candy.
Yeah.
Literally.
There is candy.
Yoni candy. I saw it the other day. I was just like, this is now truly... This is crazy.
This is unethical also.
Exactly.
Because you're really, I don't have the proper words, but you're taking women for idiots because and it's wasting time, because what if I actually have a real problem? By the time you're saying you're dealing with cysts.
Exactly.
I should be in a doctor's office.
Exactly. So a lot of these practices are unnecessary, harmful, unregulated, and that's the craziest part about it. It's willing buyer, willing seller. In all honesty, I'm gonna go get something like a sackcloth, put whatever it is that I need to put in it, and I'm gonna sell it to you. And some studies around the world have broken down Yoni products and seen what's inside them. And some of them contain really high levels of estrogen, sufficient enough to cause vaginal cancer in future. Some of them contain things like calcium hydroxide. The little paper bag that you get inside your new handbag with the little crystals inside. It's supposed to make it dry.
Yes.
It's an anhydrous pellet that's supposed to absorb moisture. So basically, they'll take the same pellets, put it in a Yoni product, insert it into the vagina. It'll remove all the moisture from the vagina, and it'll give you an illusion of tightness when it's actually dryness. It's actually not. And that dryness is so harmful because it'll put your pH off. You'll get infections. And the honest truth is that, you see, as doctors, we cannot necessarily always outrightly reveal some of the things that we see. But some of the things that I've seen even a person who left a Yoni product inside her vagina for just slightly longer than what was regulated or recommended. And she got a terrible abscess. It ate through the walls of her vagina. I literally had to take her to theater, cut out all the rotten part and stitch it back together. And these are the things that nobody tells you, because you're just like, oh yes, I want tightness. There's also...
Like, you're saying that story and I'm trying to not choke up, because I'm just like, not only have you failed on the promise,
exactly,
but you've caused damage.
You've caused damage. And you've not just caused vaginal damage, you've caused emotional trauma, which this person is later going to have to deal with. You've caused a medical condition. She had to literally get to surgery because of this. And the truth of the matter is, she did want tightness, and there was other ways of doing it. You could actually still achieved exactly what you needed to achieve. So other than Yoni products, we also have the steaming, the Vajacials. And remember, initially I said this is a self-cleansing organ.
Yes.
So what are we cleaning? Like, what are we actually
And that's what I always thought. I'm like, don't I know this thing? It
cleans
just
itself.
handles itself.
Cleans
you
itself.
know? So I don't know this steam that's rose flavored.
Exactly. I know, and with scented and all that, because you want to create the illusion of freshness, or you want to change the skin around the vulva. And to me, that's wild, because I've dealt with burns, scalds.
From someone who went for
processes like this, exactly, from processes like this. And now we have a whole new issue. We have to involve a plastic surgeon. We have to do grafting, maybe say from another part of your body, to put skin on your vulva, because all the skin got scalded off. And even if you say, I'm going to be careful and all that, truly, what are you trying to achieve?
Yeah.
What are you actually
trying?
What
is the why?
Exactly. What are you trying to achieve?
Why.
Because if it's a particular smell, then truly get over the fact that it has a scent.
Yeah.
It has been like this since the day you were born.
And the scent isn't bad.
It's not a bad scent. That's the thing. Yeah.
Let's also accept.
Who taught you it's bad?
That is it.
Who said this to
Yeah.
you? Who ingrained it in you, you know? And that's basically maybe getting to the root of the problem. So wanting tightness, wanting freshness, wanting a more youthful appearance, you know, all of those are okay. I'm not going to sit here and disqualify those needs. Women do have those needs, but truly there are safer ways of doing it. The little, and this sometimes is part of the Vajacials, the ouds and the little jikos that exist that have their special kind of charcoal and their special kind of scent, other than being a fire hazard, so to speak, other than being able to burn yourself.
Yes.
They also release carbon monoxide, which is cancerogenic, which is medically proven that carbon monoxide can cause cancer, you know, in organs. Maybe not today, maybe not, you know, tomorrow, but in a few years' time, you know, and both vulval and vaginal cancer. Like, what would you tell yourself if you had vaginal cancer from something that you didn't even need to do? Like, it truly wasn't even necessary.
Is it worth this risk?
Exactly. Is it worth the burns? Is it worth the infections? Is it worth the altered pH, the scalds, and just the general harm that it's causing you? And also, as you mentioned, for whom?
For whom?
For whom?
A lot of times as women, like, how our body should look is dictated by what's socially acceptable, and that will make, in many situations, you be chosen by a man, and that the man, your vagina needs to smell like roses.
Exactly. And sometimes that's brought about by culture, but sometimes it's also just unrealistic beauty expectations of society. Sometimes it's even weird things like the porn industry. You're like, oh my goodness, if this girl looks like this in porn, this is how I should look. No, absolutely not. No. You don't have to look like that. So there's influence from all sorts of areas, from maybe difficult upbringings, from culture, from religion, from the beauty industry, from the porn industry, from male-dominated world, from so many areas. And it's a lot for women. Truly, it's a lot to be able to deal with, to be able to say, I'm enough, I'm normal, this is okay, you know? Yeah.
So could we just say, as a blanket statement, would I be right to say, if matters vagina should be left to gynecologists?
Yeah.
And then if you want a procedure for, as you defined it, then we're talking about a cosmetic gynecologist.
Yes.
It shouldn't be, that should just be our rule of thumb.
That's the rule of thumb.
It should not be in a spa.
Yeah.
It should not be in the lady who talks at the bridal shower.
Yeah.
Spare bedroom.
Yeah.
Please no.
That's the rule of thumb.
So we're not disqualifying what you're seeking.
Yeah.
But don't seek it there.
Yeah, seek it the right way.
Yes.
Yeah.
So let's talk alternatives, right? Yeah. So if someone is okay, so we've said the scent, man, guys. Let's just accept.
Yeah.
And in accepting, it's not that it smells bad. It's to be like, it's a wonderful.
Yeah, embrace it.
Yeah. It's a wonderful scent.
Yeah.
It's a wonderful scent. If my issue is aesthetics or tightness, or I'm not getting as wet as I used to, what are the alternatives that can help me address that? When I come to see you, Dr. Sule, right, what should I be listening out for you when you're saying these things? Yeah.
So, of course, our consultations generally start with you telling me what you feel is off, right? Because sometimes you just need a reassurance and a pat on the back and this is not a problem.
Yeah.
But sometimes it's an actual problem. So you being able to describe it to me, like, this is what I'm feeling, and then, truly, if it is valid, then we will deal with it. We also do something called a female sexual function index. So basically what I'm doing is giving you questionnaires that tell me about what your intimate wellness and sex life is like, and we're scoring you because we want to rescore you after our treatment so that we can technically and realistically see that this treatment has caused improvement in what we gave to you in the first place. This is not just like, I kind of feel better. No, we need like solid, points where we can say this was like this and now it's like this. Yeah, tracking. So it's actually, it's a medical procedure. It's science. And with science, you have to be able to see before and afters of things, And if it's aesthetics, you will be able to see like the surgical work, what a woman looked like before and what she looks like after. So we do give the questionnaires. Sometimes if we suspect that a person maybe may have something like body dysmorphia, we will do an assessment. And if we're not able to, assess very well, we may send you actually to your therapist or to your psychiatrist and say, please come back with this letter saying that you actually don't have body dysmorphia and that I can actually proceed with this surgery. Because you may be one of those people who has body dysmorphia and then tomorrow the surgery will not be enough to
want
cure
more,
it.
Yeah, because it's not about this.
Other than wanting more, you'll not be satisfied with whatever you get because you have a psychiatric condition that does not allow you to see that this was bad and now it's better. So you keep coming back and you will also see other parts of your body that you don't like. You'll be like, okay, now I need a breast job, now I need a butt lift, now I need this, now I need that, and it'll never end. So we need to assess that truly. And not all patients need this assessment, but majority do. We are able to kind of tell, like, this person looks like they could have body dysmorphia. And they're just those people who say, look, I don't even actually care what it looks like. I just need it to be tighter because I've had 5 babies. Each of those babies was over 5 kilos. I'm telling you, things are not the way they were. Please return me to factory settings. And then for that, we don't need to do very deep assessments. But we do have to have it at the back of our mind that what if this person actually has a psychiatric condition that doesn't allow them to have this? So those
I love that you do that.
We have to assess. We have to assess that you're actually of sound mind to receive such a surgery. Not everybody does it, but some people will do it. And not everybody needs it, but some people actually do. And then we go through the kind of procedures that are available. So, for example, if the labias are lengthened, we could do a labiaplasty, meaning we could shorten them. If they're chafing against each other, you can't run, you can't walk, you can't have sex comfortably. Truly, they need to be smaller. And we get women who have very large ones, extending all the way up to their thigh. Cosmetic gynecology-wise, it needs to be just 1 centimeter and not be way below the labia majora. If it's way below the labia majora, that's a problem. It's going to cause functional issues, and you may not like the way it looks. So that's one of the ways we could alter the length and even the shape, and even the color pattern.
Oh wow!
Because some women have it, dark at the top, pink at the bottom, and we could even that out by surgery.
I didn't know you could do that.
It's very
you guys are magicians.
It's very artistic work. So that's one of the things. We could, for example, for older women who lose the fat content in their labia majora and they become like kind of saggy, we could do a filler, for example. We could do a labia majora plasty. We could do a lipo and fill the labia majora with fat to make them more youthful.
This is so interesting because I did not know these things were possible.
So that's possible, and that's for aesthetics as well. It doesn't necessarily have sexual function, but it helps it look a little bit better for you, especially for women who maybe are aging or women who've lost a drastic amount of weight. I don't know if you've heard of Ozempic vulva.
No, I haven't.
Yeah, so a lot of women who are on Ozempic or any other GLP tend to lose a lot of fat in their vulva, and then if they get that kind of sagging, so they may want a filler. You could do a fat filler, or you could do a hyaluronic acid filler, which is just a 20-minute procedure in the office, and it's a more youthful shape because you cannot control the areas of your body that are losing fat or losing weight. So we're getting a lot of that in terms of fillers for women who are on, drastic weight loss. Not everybody's vulva gets affected, but some women do. You could have a vaginoplasty, so you could have a non-surgical vaginoplasty or a surgical vaginoplasty. So with non-surgical vaginoplasty, we're looking at things like radiofrequency treatment or laser.
What? Like I'm just literally like mesmerized by everything that you're saying. Okay.
So, like radiofrequency isn't radiotherapy. Radiofrequency is a thermal treatment. Radiotherapy is cancer treatment. So this thermal treatment helps to build collagen in the vagina, build new blood vessels and make the nerve endings more sensitive and make the glands in the vagina start lubricating for themselves. This is a treatment that we like to use for reproductive age women. Basically, we are restoring the tightness and the lubrication, and we're making your body do it for you. Your body starts to produce more collagen. Your body starts to produce more lubrication. The downside of non-surgical treatments is that with time that effect does die down, and then you do need a touch-up, and that's the honest truth of it, because collagen gets broken down systematically in the body with time and with aging, so we need to rebuild it up. But basically, non-surgical, painless, I call it the lunchtime procedure.
I'm going to ask, I did not know you could like come in, even when you're talking about one earlier, like it's 20 minutes. And, like what?
Yeah, absolutely. So, and then you feel the tightness. But the other thing about both radiofrequency and laser is that you get better sensitivity, which is again why I like to really insist that the doctor you're seeing is a cosmetic gynecologist, because they need to not only know how their machine works, but the science of what it's doing to you. They need to explain it to you in a term that you understand, that, you know what, I'm building collagen, I'm building blood vessels, I'm going to get better nerve endings, and this is why sex is going to feel better for me. And in 1 year, my body will break down the collagen and I'll make new one through this procedure.
Yes.
That makes sense.
Yeah.
You know, and in a
you
safe
you're
way.
even expecting things, you can
Exactly.
understand what's happening with your body.
Exactly. So they need to understand the physiology behind it, but also how their machine works, because not all machines are the same. Some are radio frequency, some are laser, some are ultrasound based, and they need to know what works well for whom and why. Not everybody's going to get laser, not everybody's going to get radio frequency. And so they need to know that this is for you because of this, because I've studied this, because it's taken me so many years to actually understand what works for you. So some women have had maybe just one baby and they didn't have a really bad tear and their baby wasn't big, and non-surgical treatment works. But women who've had consecutive, very close together, big babies, they do need probably a surgery, because with surgery we just cut out a tiny piece of, well, not tiny, a significant piece of the vagina, and we bring it back together. And so you get, you know, the tightness that you wanted, and that doesn't kind of fade with time unless you have another delivery. So usually I try to tell my patients, you're either, you know, looking to be done with deliveries, or we're looking to redo this after you have another baby, or you're looking to have a cesarean section, because I don't want my very detailed work destroyed. And you're feeling like Picasso, and then you just destroy it with another baby. So there has to be also, you know, indications of why we do this. And then we also do things like clitoroplasties, not just for women who've had FGM, but this is clitoral surgery. Some women have a very large hood for the clitoris, and the way the clitoris works is that if the hood is very large, it protects the clitoris and it doesn't get exposed, and women get really poor sensitivity. So sometimes it makes sense to reduce the hood a little bit, just to have a little more exposure for better sensitivity. Not everybody needs this, but some women have such a long hood that it goes way beyond even their labia majora and minora. And we don't know why this happens to certain people, but if it's that, you know, lengthy or that, you know, full, it does need to be brought back a little bit. And some women will say, okay, you know what, some women just kind of do it manually for themselves, but some women will actually say, no, I can't keep, you know, manipulating myself every time that I need to have intercourse. I'm gonna just like have the surgery and get that over and done with. We also do actually intimate lightening. So even the hyperpigmentation that comes,
that people go to
that people
the
are
spas.
doing the creams and spas and all that, that's actually a cosmetic gynecology procedure, because what we do is we have special preparations. It's like, well, right now Africa isn't producing them, so we get our products from Europe, mostly like Spain, Sweden, and then it's a 7-step process. It's a 90 days process. Like 7-step in the clinic takes 4 hours, and then another 90 days at home. So we're monitoring, we're taking photos, we're seeing that it's getting lighter, we are testing your skin before. Like, it's such a process, not just apply this cream. I once got a patient, she was 19 years old, and hyperpigmentation unfortunately presents itself a lot more in lighter skin women, in fairer skin women, because the contrast is so sharp with the light skin and the dark skin. Not that darker skin women don't get it, they do get it, but it's just not as visible and it's not as obvious. And so she went and she got this intimate lightening cream, and I took photos of it because it literally shocked me. No name, no manufacture date, no expiry date, no contents, no regulatory, nothing.
So we don't even know what it is.
We have no idea what on earth this is. Her skin in her entire vulva and mid-thighs peeled off. All of it.
How painful.
All of it. It was literally like, you know, 2nd, 3rd degree burns. She needed grafting. Like, we actually had to graft her skin. She was 19.
And now we don't even know even who to report or hold accountable, because what is this
nothing.
thing?
I mean, she knows the shop. And of course, when she went, she couldn't actually walk. That's how bad it was. When she goes back to the shop, it's literally willing buyer, willing seller. There's nothing you can do. Nobody forced you to buy it. This is unregulated substances, you know, nothing. I remember looking at the tube. It had a name. It was a foreign name. But I'm like, this means nothing. It could mean, I don't know, flower. Or
And also, we don't know now the ingredient. What are we dealing with?
We don't even know the because when we know the contents, then we know the antidote.
Yes.
You know, so if it's like hydrogen peroxide, then I know what to do. But if there's no contents, no manufacture, no, this is a product of X country, nothing on the tube. And I'm 100% sure she's not the only one.
Yeah.
So all of this is available. It just needs to be done in a regulated manner. For women, for example, who want tightness, because cosmetic gynecology procedures are expensive.
Yeah.
Kegels are free, you know.
I was telling you about this. This TikTok lady.
Yeah.
I think she's a gyna in the States. And she does this like Kegel exercises.
Aerobics.
And it's aerobics actually, because you're just sitting at your desk and no one knows. And she has a song playing, and when she does this, it means hold. So she'll do with a beat. So you're there like typing, and you're there like. When I stumbled upon her, and then I followed her because I just thought, this is such a fun way for us to do this thing. Absolutely. And it's a lady leading us, and we're having fun with it, and it's free.
And it's free. That's the most important thing, because every time I give this information, people say, well, all this stuff is so expensive. And that's the truth. It is the honest truth. Cosmetic gynecology is not accessible to everyone. But there are things that you can do that cost less and that are free. But most importantly, it needs to be safe, because this is the most intimate part of your body. This is not the time to be skimping out on stuff. This is not the time for, I'm going to take this cheaper option. No.
Because is the cheaper option really cheaper? Because
it's the harmful option.
It's harmful, and then you're not seeing any change. So you keep buying and buying and buying, even if you're the one who gets away with maybe not getting an infection, which is also an expensive side. But even here, you're buying and buying and buying, and it's valid. What you're seeking is valid. So perhaps it's just like organizing yourself and saying, okay, Dr. Sule, I think I can only see you in 2 years.
Exactly.
Yeah,
absolutely. Yeah. And so there's something I was saying before I got into
the
this.
Kegel exercises. Sorry, I went to the TikToking gynecologist.
Yeah, so Kegels are free.
Yeah.
I love telling my patients, after they've had a vaginal delivery, or even if they haven't, Kegels are great. The science behind Kegels is a little bit tricky, because you need to do so many for you to, just kind of like be back to where you were before baby, for example. So scientifically, it says you need about 3,600 Kegels a day, which is a very difficult number to achieve, and that's scientifically. Of course, most people won't reach it, but I'm going to say, like, do what you can, do what you can. Nowadays, we have special pelvic floor chairs. Okay. It does 11,000 Kegels for you in half an hour.
What?
Yes.
This is better than my TikTok.
And it's non-invasive. So you just sit fully clothed on your chair, and it does it through magnetic energy, and it just does the Kegels for you. You do your 30 minutes, and it helps not just like with your Kegels, but generally with your pelvic floor for women who have mild urinary incontinence. It helps that as well, because it's strengthening the whole pelvic floor. It's not isolating particular muscles. So that's another thing. Fine, yes, still costs. But it's better. An option. Nobody cut you up. Nobody inserted anything. You sat on a chair fully clothed, and you're good to go. So
this is so interesting. These are things that I did not know all this exists.
Yeah, so those are the alternatives that are that are available. So no need to harm yourself. No need to go for something because it's cheap, or because your friends spoke about it or whatever. Just I feel like the most intimate part of your body, give yourself the best.
And I think also the shame leads us to this buying these things undercover,
the desperation. A lot of women, like, their relationships are breaking down because of the lack of intimate wellness or with sexual dysfunction. So sometimes women are doing this to preserve a relationship, to preserve a marriage. So I don't want to sit here and say, why are you doing this? No, you do have a reason, and your reason is valid. You want to keep your relationship together. But this is actually something that could potentially break that relationship even further. If you're having and break you and your mental health and just your general well-being and even your self-esteem, how you view yourself, you could really regret it afterwards. And then that's another thing that now you're trying to, sort out and rebuild afterwards. Like, is it actually, worth it?
This is so interesting. And I think it also speaks to this, a podcast I listened to some time back, and we spoke about it in the last season. We had Dr. Kenya, who all the incredible Kenyan female doctors always mention the other. They're like, oh, and so she mentioned you.
Oh.
And we were talking about Halle Berry was speaking about estrogen creams.
Right.
And wanting to enjoy sex even in her age,
Menopause,
right?
yeah.
I think she's 59 now,
Yeah.
right?
Yeah.
And I remember being like, yeah, why? First, it's almost frowned upon to enjoy sex as a woman, or to know what you like, or to seek sex as a woman is like frowned upon. And so even conversations around, I want maybe this procedure because maybe after kids or whatever the case is, I'm not feeling the sensations.
The same way,
I want to enjoy it. Yeah. It's important. You know what I mean? Yeah. I think even that affirms like, and when you go to the doctor, there's no shame. It's like, we want you to enjoy the things you want to enjoy. Yeah. How do we get there? Yeah. And so I think it's really important even just having these conversations to affirm that and also to affirm the alternatives. Yeah. You don't have to do something that's going to lead you to theater. We're having burns, you can't walk, like please, these are the options. Yeah. There's something you talk about that is very interesting. Intimate wellness. Yeah. Did I get it right? Yes. What is that? If you define that, what is that?
I'd say it's when a woman's intimate life is in order. You know, it's a pain-free, comfortable, confident space in terms of how she explores intimacy, regardless of her partner, within herself. Yeah. It's basically, you know, my intimacy is in order, which a lot of us, you know, probably don't enjoy. A lot of studies have said that, and these are Western studies, but these are not even like African studies, that about 60% of women can't actually have an orgasm.
Yes.
And that is crazy. And these are people who actually went and reported to a doctor. So how much is unreported, right? And in the little percent that's left, women still will probably not understand even the kind of, you know, orgasm that they have, you know, whether it's vaginal, clitoral, both, you know, penetrative, non-penetrative. So intimate wellness is such personal ownership. It's you understanding, you know, is my intimacy truly in order? Am I pain-free? Am I comfortable? Am I confident? Am I enjoying this? Because it's not mechanical. We're not doing it for the sake of doing it. We're doing it to get some form of enjoyment. So for me, is that process in order for you? And because for women, our intimate wellness is so multifaceted. It starts in our mind. Yes. You know, like when you're stressed, you could literally be thinking about your washing machine during sex. You know, it's like, this thing is not working and I didn't get my laundry done. Or my boss wants this from me, or my child wants the following.
And you have to be like, oh wait.
So for us, it is in the mind. And for men, that process is a little bit more straightforward. For them, their issues are much less. You know, they have erectile dysfunction, they have premature ejaculation, and that's more or less it. For us, it's so many things. It's sensitivity, it's dryness, it's you
even
know,
social, cultural, right?
Exactly. It's just so multifaceted. So when all those facets are in order, then you can say truly I do have intimate wellness. And when either of them is not, then you can present it to whomever is relevant, you know, whether it's your doctor or a real therapist or whomever. And you should be able to present it at any age. One of my oldest patients is 88.
Oh, that's wonderful.
And she comes with her husband.
That is so adorable.
And she comes for actual cosmetic gynecology treatments. And every time I tell people this, they're like, oh my goodness, are they actually like having sex? And I'm like,
yes, and they should.
And they should have it in an enjoyable way. You know, and so, and one of my patients once told me, she said, you're a gynecologist for all seasons. I'm like, you know what, I am, because I have teenagers and then I have the 88-year-old.
That's so wonderful.
And it just means that for every area of your life, you need to be able to connect with your gynecologist and enjoy that area, whether it's pregnancy, whether it's delivery, whether it's even a hysterectomy because your fibroids were giving you issues and now you actually want just relief from that. You know, for all the seasons, you should be able to enjoy, you know, your reproductive and sexual health to the fullest. Truly, you should be. It's not an age issue. And we should do everything in our capacity to allow you to enjoy it. Whether it means giving you a hormone, whether it means giving you radiofrequency treatment, whether it means giving you a non-surgical treatment, a surgical treatment, whatever it is for you to attain that intimate wellness so that then you also own it and say, you know what, me and my doctor, this is where we have arrived, you know.
And what I was going to say, it's funny you ended there because I was going to say, and I think it starts with like ownership.
It's ownership,
right?
For sure.
And even in terms of even just your 88-year-old patient who I'm just like, goals. That's going on my vision board, how I want to age. It's that you should want to enjoy things. And even when I know the vagina is expansive beyond sex, but even with sex, it's that you should own the process. Yeah. It's not for someone else. Yeah. You are also part of the process, so you should enjoy it. Yeah. And you have the voice to say, I'm not enjoying it because maybe I'm getting older. I'm not getting as lubricated as I once used to. What do I do? Yeah. Are there things that can help me with this? Yeah. For me to enjoy it, right?
Because you're the only one who knows what it's like to live in your body. Your doctor has no idea.
Exactly.
The people around you have no idea, including your actual partner. You inhabit your own body. So you're the one to say, you know what, I need this better and I deserve better, and it's your right.
And so that's why I keep on saying I'm very thankful for helping me unlearn it, because I think I had the privilege of age and the vagina that I have, that I hadn't been in a situation where I'd be like,
this is it.
Excuse me. That thing I was saying is not relevant. Please come. So now I'm just like, no, it's part of agency. Yeah. It's part of women owning their bodies. Yeah. And so to the woman watching who is first inspired to grab a mirror tonight, put that leg on your bathtub, on your toilet, like start to intimately get to see what your vagina looks like. What is one thing you want to leave her with? Like, we've talked about intimate wellness, we've talked about the alternatives. You've affirmed the why, which I think is so powerful. Like, if there's something you feel uncomfortable with, that matters. What's like one thing you want to leave her with?
I'd say listen to your body, because you deserve the best. Yeah. You truly deserve the best, honestly. Don't, sit in a corner. Don't not talk about it because other people are not talking about it. Don't shy away from it. Don't fail to bring it up because you don't know how your partner is going to perceive it or society is going to perceive it. You truly deserve the best. You deserve to. It's your right. It's actually your right. Forget everything that you've been told before. Forget, don't talk about it, it's shameful or whatever. Yeah. Who does that? Or women who do that are promiscuous or they're mannerless.
Women are mannerless. It's a good thing to be mannerless.
But enjoy it. Enjoy it. Speak up about it. It is your right, and you deserve the absolute best reproductive and intimate health.
I love that. Very affirming. And another thing I want to thank you for is that you said you were going to share a link that so we can even be able to check if doctors are registered and what they're registered for. So that's going to be in the description. Yes. Just our way of like even starting that process of like steering away from things that could harm you. Yeah. And you being exposed to, okay, what are my options while I'm in Kenya? Who
exactly. I mean, in other countries.
Yeah. Exactly. And of course, we're also going to share all the links for how you can connect with Dr. Sule and the incredible work that she does. So whether it's you just want to follow her because she shares such educational things, I'm just like, wow, you made it so simple for me to understand what's happening here. Or, book a session with her to go for a consultancy and see the incredible work she's doing, even in changing what the pregnancy journey is for women in Africa. Yeah. Incredible work you're doing.
Thank you so much.
So I have to thank you for all that work and for coming on the show.
Thank you for having me. It's been amazing. I really appreciate the space that you've created for women just to be able to understand themselves. Very few people kind of push the envelope like that. Women have a lot of conversations around, themselves and their health and, what's right and all, but not like this.
Yes, but I think it's so fun.
You.
Vaginas are it.
You're doing amazing things.
Thank you so much. And I hope you enjoyed this episode. If you have, make sure you share it with another woman in your life who is on her way to mannerlessness, and check out the description for all the links that I just spoke about, and don't forget to subscribe as well so that you do not miss the next episode.